Hello everyone, welcome back to Jacob's Academy of Nursing. So in today's session, we'll be learning about the respiratory system, covering important structures, functions and key points essential for exams and clinical practice. So if you are preparing for nursing exams or aiming to strengthen your fundamentals, you are in the right place. So let's get started. In this session, we will cover the respiratory system in a structure and easy to understand manner. So we will begin with a brief introduction and discuss the functions of the respiratory system, followed by the parts of the respiratory system. Next, we will focus on the upper respiratory tract, including the nose, pharynx and larynx, and understanding the functions in detail. We will then move on to the lower respiratory tract, covering the trachea, bronchi, bronchioles, lungs and alveoli. So after that, we will explain the process of breathing, including inspiration and expiration, and understand the exchange of gases and regulation of respiration. We will also discuss some common respiratory diseases and highlight the importance of the respiratory system for nurses. Finally, the session will conclude with a summary of key points. We can see the introduction. The respiratory system is responsible for the process of breathing and the exchange of gases between the body and the environment. It supplies oxygen to the body, which is essential for cellular respiration and energy production, and removes carbon dioxide, a waste product of metabolism. Proper functioning of the respiratory system is necessary for maintaining life and normal body function. So any impairment in this system can directly affect overall health. So making the respiratory system one of the most important systems in the human body. Now let us understand the respiratory system. First we can see the definition. The respiratory system is the system of organs responsible for the process of breathing and the exchange of gases, supplying oxygen to the body and removing carbon dioxide from the body. So which is a waste product of metabolism. And oxygen is very essential for cellular respiration and energy production. So by removing of carbon dioxide, which will help to maintain normal body functions. So now let us look at the functions of the respiratory system. First, it provides oxygen to the blood, which is very necessary for all body cells. Second, it helps in the removal of carbon dioxide, so which will preventing acid buildup in the body. The third one, the respiratory system plays an important role in the regulation of blood pH. So it is also responsible for voice production through the larynx and helps in the sense of smell through the nasal cavity. Additionally, the respiratory system helps in maintaining body temperature by regulating heat and moisture during breathing. So these functions highlight why the respiratory system is clinically very important for the nurses to understand. So here image is there, so you can see the labeling parts for your reference. Now let us move on to the parts of the respiratory system. So the respiratory system is broadly divided into two main parts: the upper respiratory tract and the lower respiratory tract. So first let us look at the upper respiratory tract. So it includes the nose or nasal cavity, the oral cavity, the larynx and the pharynx. So these structures helps in filtering, warming and moisturizing the air before it reaches the lungs. Next is the lower respiratory tract. It begins with the trachea, which then divided into bronchi, and the bronchi further branch into smaller tubes and finally lead to the lungs, where actual gas exchange take place. So understanding the divisions of the respiratory system into upper and lower parts is very important for clinical assessment, diagnosis and nursing care, especially when managing patients with respiratory conditions. So here in this image you can see the labeling parts which mentions the parts. Now let us discuss the upper respiratory tract. So the upper respiratory tract includes the nose, nasal cavity, pharynx and larynx. So the air enters the body through the nose and passes into the nasal cavity. So here the air is filtered, warmed and moistened before moving further down the respiratory tract. So coming to the pharynx, which is act as a common passage for both air and food. So directing air towards the larynx, and the larynx which is also known as voice box, so which is help in voice production and protect the lower airway during swallowing. So the main function of the upper respiratory tract are to filter the air, warm the air and moisten the air, ensuring that clean and conditioned air reaches the lungs. So understanding these functions is very important for nurses, especially when caring for patients with upper respiratory infections or like breathing difficulties. Now let us discuss the nose, so which is the first part of the respiratory system. So the air enters the respiratory system through nostrils, the inside of the nose which contains hair, so which will help in filtering dust, dirt and microorganisms from the air. So the nose is lined with a mucous membrane, and this membrane traps fine particles and helps in moistening the air before it passes through into the respiratory tract. And the nasal cavity which will also help in warming the air, making it suitable for the lungs. And in addition to respiration, the nose plays an important role in the sense of smell. So these functions of the nose which will help to protect the lower respiratory tract and very important from a clinical and nursing care. Now let us discuss the pharynx. So the pharynx is a muscular tube that acts as a common passage for both air and food. So it connects the nasal cavity to the larynx and also communicate with the esophagus. So the pharynx is divided into three parts. The first part is the nasopharynx, which lies behind the nasal cavity. It is involved only in respiration and allows air to pass from the nose to the pharynx. The second part is the oropharynx, which lies behind the oral cavity, and it serves as a passage for both air and the food. The third part is the laryngopharynx, so which is the lower part of the pharynx. It directs air into the larynx and food into the esophagus. So the pharynx plays an important role in breathing, swallowing and speech, and making it clinically significant in nursing practice. Now let us discuss larynx. The larynx is commonly known as the voice box, and it is located between the pharynx and the trachea. And the larynx contains the vocal cords which help us produce sound. And also when air passes through the vocal cord, it will vibrate and create our voice. And the other important parts of the larynx is the epiglottis. So the epiglottis acts like a flap, means it prevents food from entering the trachea while swallowing and direct food into the food pipe. So the main functions of the larynx are voice production, breathing and protection of the airway. Now let us discuss lower respiratory tract. So the lower respiratory tract includes the organs that help in air passage and gas exchange. So it includes 5 main parts. So the first one is trachea. The trachea is also known as the windpipe, and it carries air from the larynx to the lungs. Next are the bronchi. So the trachea divided into 2 bronchi, one entering each lung. So the bronchi further divided into smaller tubes called bronchioles. So these bronchioles helps distribute air throughout the lungs. So the lungs are the main organs of respiration, and they are soft, spongy and elastic. So inside the lungs are tiny air sacs called alveoli. So the alveoli are very important because exchange of oxygen and carbon dioxide take place there. So the main function of the lower respiratory tract is to conduct air and allow the gas exchange. So here in this image you can see the labeling parts of the lower respiratory tract. Now let us discuss the trachea and the bronchi. So first we can see the trachea. So the trachea is also called the windpipe, and it extends from the larynx to the bronchi. So the trachea is supported by C-shaped cartilage rings. So these rings keep the airway like open and prevent the trachea from collapsing. So the main function of the trachea is to allow free passage of air to and from the lung. Now upcoming to bronchi. So the trachea divided into right and left bronchi. So each bronchioles enter one lung. The right bronchus is shorter and wider than the left bronchus. So inside the lungs, the bronchi branches repeatedly into smaller tubes and forming bronchioles. So the trachea and bronchi together help in conducting air efficiently to the lungs. So here image for your reference you can see here. Now let us discuss the bronchioles and the lungs. First the bronchioles. So the bronchioles are the smaller branches of the bronchi. Unlike the bronchi, bronchioles do not have cartilage and they end in alveolar ducts which leads to the alveoli. And the bronchioles help in regulating airflow by contracting or relaxing their smooth muscles. So now coming to the lungs. The lungs are a pair of spongy organs. They are located in the thoracic cavity. And the right lung has 3 lobes. So while the left lung, it has only 2 lobes to accommodate the heart. So the lungs are covered by pleura. It's a protective membrane that reduces the friction during breathing. So the bronchioles regulate airflow and the lung are the main organs of respiration. Now let us learn about the alveoli and the process of breathing. First the alveoli. Alveoli are tiny air sacs present at the end of bronchioles. So they are actual sites of gas exchange in the lungs. So the walls of the alveoli are very thin and which allow easy diffusion of gases. So each alveole is surrounded by capillaries. And here oxygen enters the blood and the carbon dioxide leaves the blood. So now let us understand the process of breathing. Breathing includes inspiration and expiration. So these are the 2 phases. So during inspiration, air enters the lungs, and during expiration, air is expelled out of the lung. So alveoli help in gas exchange, and the breathing ensures continuous supply of oxygen and removal of carbon dioxide. Now let us understand the 2 phases of breathing, inspiration and expiration. So the first one is inspiration. Inspiration is a active process. During inspiration, the diaphragm contracts and moves downward. At the same time, the chest cavity expands. So because of the chest cavity expands, the pressure inside the lungs decreases and the air enters the lungs. Now we can see expiration. Expiration is a passive process. During expiration, the diaphragm relaxes and moves upward. So, the chest cavity decreases in size. As a result, the pressure inside the lungs increases and air moves out of the lungs. So, inspiration brings oxygen into the body and expiration removes carbon dioxide from the body. So, look at the diagram carefully. So, it shows what happens during breathing. So, the left diagram, you can see the inspiration. So, during inspiration, the diaphragm contracts and move downwards. And the ribs move upward and outward. So, because of this, the thoracic cavity expands. So, when the chest cavity expands, the air pressure inside the lungs decreases. So, air flows into the lungs as shown by the arrows. And coming to the right diagram, expiration. So, during expiration, the diaphragm relaxes and moves upward. So, the ribs move downward and inward. So, the chest cavity becomes smaller. So, this increases the pressure inside the lungs. So, as a result, air moves out of the lungs, shows by the arrow going on. So, inspiration brings oxygen into the lungs and the expiration, it will remove the carbon dioxide from the body. Now, let us understand the exchange of gases. The exchange of gases occurs at the alveoli. At the alveoli, oxygen diffuses into the blood present in the surrounding capillaries. So, at the same time, carbon dioxide diffuses out of the blood into the alveoli. So, this exchange happens by diffusion and is based on the concentration gradient. So, gases move from a region of higher concentration to the lower concentration. So, now let us see how respiration is regulated. Respiration is controlled by the respiratory center located in the medulla oblongata. So, chemoreceptors continuously monitor the gases in the blood. So, the level of carbon dioxide in the blood is the most important factors controlling the breathing. So, when carbon dioxide levels increase, it will get the signals are sent to the respiratory center, and the rate and the depth of the breathing, it will increases to remove excess carbon dioxide. So, the gas exchange occurs at the alveoli by diffusion and respiration is regulated by the medulla oblongata in response to carbon dioxide levels. Now, let us briefly discuss some common respiratory diseases. First one, we can see asthma. It's a condition in which the airways become narrow and inflamed. So, it will cause us difficulty in breathing, wheezing and cough. So, the second one is bronchitis. So, bronchitis is the inflammation of the bronchi. It leads to persistent cough with mucus production. And the third one is pneumonia. So, you all know regarding pneumonia. So, pneumonia is an infection. It will affect the lungs. Yeah. And the alveoli fill with fluid or pus. So, it will cause fever, cough and breathing difficulties. So, the fourth one is TB, tuberculosis. So, the tuberculosis is a chronic infectious disease. It will caused by the bacteria and it mainly affect the lungs and spread through air droplets. So, COPD. So, COPD means chronic obstructive pulmonary disease. So, it's a long-term disease that causes obstruction of airflow, commonly due to smoking. So, the respiratory diseases affect the airways and lungs and leads to difficulty in breathing. Now, let us see why understanding the respiratory system is important for nurses. So, the first point is assess breathing pattern. So, the nurses must assess the patient patient breathing pattern, including rate, rhythm, and depth. So the second point, monitor oxygen saturation. So they should monitor oxygen saturation regularly using a pulse oximeter. And the third point is provide oxygen therapy. So the nurses are responsible for providing oxygen therapy safely and effective when it is required to the patient. So the fourth point, early detection of respiratory distress. So it is very important to prevent complications. The last one, patient education, which means health education. So the nurses plays a very important role to do education for the patients, to teach breathing exercise, proper inhaler uses, and lifestyle modification. So a good knowledge of the respiratory system helps nurse provide safe, timely, and effective patient care. Now, let us summarize what we have learned about the respiratory system today. The respiratory system is responsible for breathing and gas exchange. It supplies oxygen to the body and removes carbon dioxide. Oxygen is essential for cellular respiration and energy production. The respiratory system is divided into upper and lower respiratory tracts. Upper respiratory tract include nose, pharynx, and larynx. Lower respiratory tracts include trachea, bronchi, bronchioles, lungs, and alveoli. Alveoli are the main site of gas exchange. Breathing includes inspiration and expiration. Respiration is regulated by the respiratory center in the medulla oblongata. Proper functioning of the respiratory system is essential for survival. Nurses play an important role in assessment and care of respiratory functions. So understanding the respiratory system, which will help us provide safe and effective patient care. Thank you for your attention. If you found this tutorial useful, please like, share, and subscribe to support Jacobs Academy of Nursing. See you in the next class. Bye.